Hello viewers, my name is Deepalakshmi and I am doing Business Intelligence and Analytics course with NSCC. In this video, I'm going to show some analysis and give some insights regarding the expenditure in healthcare industry in Canada. This analysis is part of my capstone project and it is sourced with the database extracted from the site called CIHI, that is Canadian Institute for Health Information. And I have chosen Power BI as a tool for visualizing the data and Excel for sourcing the data. And this is my first presentation on detailed analysis of healthcare expenses in Canada. And now, to begin with, I must say the reason why I choose this topic to analyze. COVID. This is the most pronounced word for the past couple of years globally. Yes, this outbreak made everyone vigilant about health, safe self-care and sanitation. This SARS-CoV-2 virus is predominantly spreading through air, and so many people died because of it. When digging into the reason why there is an always increase in the spread and why there is a lack of treatment, and it is obvious that the public healthcare body played a vital role. The Canada's medical care industry is one of the prominent fields which coped up during this pandemic situations. Also, I want to know how the funding by both provincial and federal governments of Canada have been allocated and how they are utilized so far. This video may interest the people from healthcare, financial advisors of some private healthcare providers, for some insurance brokers, and the people who are working in healthcare industry. Now, come on, let's hit the road. The contents of this video is listed in here. First, I'm going to deal with year-wise expenses. Secondly, a quick comparison between Canada and the Atlantic Canada. Third, the healthcare expenditure according to the average spending per person. Fourth one, this is other healthcare expenses related to medical, like hospitals, physicians, drugs. Those are all the expenses going to deal with this slide, and streamlining to the next phase that is called I'm going to deal with Nova Scotia. What happened in the years 19 and 20, just to show the comparison for post-COVID and pre-COVID situations. Next, I'm going to explain the spend by years based on the genders in Nova Scotia. And the last explanation is about healthcare spending according to the age group in both the genders. So, moving on to the first slide, the annual expenses happened in the healthcare industry in Canada. Though the data extracted was from 1970s, I have shown only the expenditure for the last 5 years, just to show the quick comparison. As seen in this chart, there is an acute increase in the year 2020. And that is from $265 billion to $294 billion. This chart is showing the rate of increase between the years 16, 17, 18, 19 and 2020. As we see, the 2020 has a drastic increase, that is 10.92% of increase from the previous year. Moving on to the next thing, this is the comparison between Atlantic Canada and Canada. So this area chart is showing the same pattern, likewise the Canada, that is the gradually increasing pattern. But when we digging into the 4 provinces in the Atlantic, the PEI and New Brunswick shows some vice versa pattern. That is, there is a gradual increase in PEI That's a gradual increase in New Brunswick, but there is a smaller than gradual increase in PEI. As we see in 2019, it was 5.6 billion for the New Brunswick and 7 billion in 2020 for the New Brunswick. So this is an acute increase, but when comparing with 2019 and 20 years for PEI, it's 1.2 and 1.3 respectively. It shows a small increase according to the population, I assume. Moving on to this donut chart, it shows the percentage of percentage of spending between Atlantic Canada and the Canada. Nearly 22.48 billion have been spent for the 4 provinces as a whole for the health care expenses. And moving on to the next slide. This is one of the great information we can have, that how much spent on per person against the total expenditure of Canada. Here I have taken Nova Scotia measures to have a quick comparison with its national counterpart. The blues are showing the Nova Scotia and the red is for Canada. So 2016, it's only $6,569 per person in Canada, but it quite big with NS per capita, that is $7,175 with NS. Also, there is a increase among the years, and in 2020 we see a pattern, that is for Nova Scotia it is 8,925 and for Canada it's only 7,749. This may be because of the amount of population we are taken into consideration, even though it is obvious that Nova Scotia needs more health funding. Moving on to the next slide. This is one of the quick comparison for other accompanied healthcare expenses. Over the years 2018, 19 and 20, the amount spent on hospitals was escalated. See, as we see in the year 2020, the hospital expenses were increased by 34.2%. And I'm sure that this is because of treating the COVID patients who needs more dedicated facilities and more infrastructures in hospitals. Moving on to the next slide. This is about Nova Scotia. These two tree graphs clearly shows the proportion of the amount spent on each subcategory for the years 2019 and 2020. As displayed, hospitals and physicians' expenditures have been enlarged from the year 19 to 20 because the state must address the problems of COVID, and also they need more doctors to get rid of this deadly novel coronavirus. Moving on to the next thing, there is annual expenses which happened in Nova Scotia. This is a comparison chart for healthcare expenses based on the gender. Here I have taken only the two dominant gender types. When we look into the overall information, the yearly expenses have been increased gradually for both the genders. But the right side chart shows the percentage of increase over the years, that is between 2016 and 2020. Even though there is some ups and downs, the female spending have some acute differences. There is a low in 2018, there is a high in 2020. And moving on to the next slide, spent by age group. This is one of the interesting chart which we can examine the healthcare expenses in all the walks of life based on the gender type. Despite this chart is showing more information, I must stress few insights in here. First, female by the age of 30 to 40 needs, like, they received more medical care because it is obvious, maybe because of maternity related expenses. And secondly, the males with 60 to 70 age group seek more care than their female counterparts. And last insight I'm giving is the 90 plus bar exposes the fact that the longevity of female lives. Is it? Yeah. So, my friends, by and large, the overall health spending in Canada has been increased, and the healthcare industry needs more funding in the coming years when comparing with some other industry. That's all, my friends. If you have any questions or suggestions, please post in the comment section. And thank you for listening.